All right, welcome to another episode of Health with Hashimoto's. I am so excited to welcome you to meet our guest today, Alissabeth Taylor. She is a functional diagnostic nutrition practitioner. She helps busy women heal gut and skin issues naturally without quick fixes and no guesswork. Through her virtual practice, she shares a root cause, whole body approach to restore energy, confidence, and vibrant health. Welcome to the podcast, Alissabeth.
Thank you. I'm so excited to be here with you.
Yes. So give us a little background. What brought you to what you do now?
Yeah. So I started out as a nurse, and was really called into that field. And as I began to grow my family, I was looking for more holistic ways to take care of my kids. And that just started incorporating things like chiropractic, homeopathy, stuff like that. And then about 10 years ago, I had a personal health crisis where it's basically like my bucket tipped over. All those things added up and then it just exploded. And that exacerbated rashes all over my body. And these were not just normal rashes. And then I had a lot of gut issues along with that. So I had to seek out help that wasn't in the medical system because they were not giving me answers. They said things were fine. They were just prescribing me creams and steroids and that kind of thing. And the catalyst was really when one of the doctors, I think it was an allergist, told me that food had nothing to do with the rashes I was experiencing.
Oh my goodness.
So there was no credit given to the nutrition aspect of things. And I just was like, okay, I guess I'm going to have to do this on my own. And I did. And it was a long, hard journey. And so that brought me to this place where I wanted to help other women with gut and skin issues who were being underserved, who were not finding answers, who were frustrated and stuck. And it just brought me to FDN, which allowed me to do health coaching that I had already studied, but it took it a step further by being able to use functional lab work to really get to the root so that we could see where the imbalances in the body lie. And then we could work with a protocol to, use the body's innate ability to heal itself with what we were doing with diet and rest and exercise and all those types of things.
Yeah, I love that because the body is always trying to heal.
Yes.
Like sometimes we get stuck in the thought of we need to fix it, but really we need to allow our body to fix what's going on. And maybe we need to stop sabotaging things.
Yeah.
So, what was the biggest thing for you? Was there one thing or was it multiple?
With my own health.
Yeah.
Um, Really, I think it had to do with the rashes. And, at the time I was teaching, and these were rashes that were like little water blisters all over my hands. They would leak and ooze, and then they would crust over, and it was really embarrassing. So when I was teaching, the kids started saying, Miss Taylor, what's wrong with your hands? And as a 30-year-old woman, it felt like you were in school again, being super self-conscious about your body. So I think that was really really my low point that made me want to figure out what it was and do whatever it took to get rid of it and not have to deal with that again because it was embarrassing. The self-identity issue of that, of any health aspect, is huge, and it's not talked about a lot.
Yeah, that is so true. Absolutely. And people talk about, invisible illnesses.
Mhm.
Um, and yes, when you have the invisible stuff, you have the self identity and you feel like a different person. But then when you have the visible stuff too, that's a whole nother layer. Like,
Yeah.
yeah, that's huge. Um, so you transitioned from nurse to functional medicine or functional nutrition. Do you still do nursing?
I have my license, but I'm not actively practicing. It's kind of there as a fallback.
Mhm.
I don't discredit any of the education I got or the experiences because it's brought me to where I am today. And I use that knowledge every day when I'm working with clients. So I am thankful for that.
Yes, absolutely. So tell me about like testing and approaches, especially in light of thyroid.
Mhm.
If somebody came to you and they said, I have Hashimoto's, where would you start?
Well, first, I would say that stress is the catalyst for everything, and that unfortunately is not just physical or emotional stress. That's the toxins in our environment, in our foods, it's the chemicals we're using in our home, it's the products we're using on our body. Um, and it could be imbalances within our body that are stressors. So there's that aspect. And then in FDN, we use a term called metabolic chaos. It's really learning that the body is interconnected. And I teach this to my clients when we're reviewing labs, that you may think you have a thyroid issue, but that may not be the root. It could be the result of another system. So when we have stress, the body, cortisol is our stress hormone. If that becomes imbalanced and the body needs more energy, it starts to pull on other body systems for energy. And then you have a system pulling on another system, and then that system gets low and it goes and it pulls from another system. So that's what we call metabolic chaos. And we talk about hormones, immune, digestion, detoxification, energy production, and nervous system in my coaching. And all of these systems connect with each other. So you may be struggling with your thyroid, but it's like the chicken or the egg. Did that come first, or is that the result of something else? And the big players with the thyroid or the adrenals, which I mentioned with cortisol, and gut health. So we look at those aspects of the body, and then we run testing. So there's different tests that you could do for thyroid. I usually start all my clients on a Dutch test, which is a hormone test, and a GI map. If they're able to, we do food sensitivity testing as well, because what you eat turns into your cells, so it's very important to make sure that the foods you're eating are serving your body and not inflaming your body. And then there's another test I've started using recently, which is a hair tissue mineral analysis, which checks mineral balance, because we don't realize that minerals are the spark plugs, for our body. And if we're imbalanced in minerals, they can work synergistically or antagonistically with other minerals, and you get these deficiencies. And we can actually see, based on certain ratios, what's going on with the adrenals, the thyroid, blood sugar, all the different things. So those are just some of the tests I utilize.
Wow. So Dutch test,
Mhm.
the hair and tissue analysis, and then what was the other one? The GI map.
Yeah. Yeah.
So if somebody has to pick just one, which one is the most, I don't know what to say, important or insightful? Like, which one would you pick if they could only do one?
Yeah. So if someone's finances are restrictive or they don't want to do all the testing, I would say a GI map, because what goes on in your gut directly reflects in other systems of the body. So if we can get a handle on, what's going on in the gut, and then work on nutrition and lifestyle protocols to help support the gut immune system, you'll really see a major improvement in most issues.
Yeah. And I love in your bio, you mentioned like you're not a proponent of short-term fixes.
Mhm.
So if somebody's working with you and they do the testing, and now you're talking about nutrition and changing lifestyle stuff, what's a good timeline for somebody to set their expectations? When should they hope to see changes?
Gosh, that's a tough one, because, we're each individual. And unfortunately, when we go to the doctor, we're all treated the same. So we're used to quick fixes, take this medicine, it's going to fix your problem, but it doesn't work for everyone. And then you spend time searching. So I like to look at bio individuality. And with my clients, the thyroid's a big one, because there's so much that impacts it. So it really just depends on the complexity of what the person has going on, the amount of stressors we see on the labs, that type of thing. But, I've had clients see improvement within a few weeks to a few months. And then I've had some that takes more like 9 to 12 months to really see. So it just depends on the individual situation.
Wow, 9 to 12 months. That's a long time.
Yeah.
Yeah.
Yes, but in that process, you're learning life-changing skills that are going to serve you for the rest of your life. So it's not like you're not learning anything.
Right.
You're making all these changes. And, I like to say it's a race, not a sprint. So
Yeah. I remember my health journey. or actually like my professional journey kind of started when my fourth son was a baby and he had eczema head to toe. And so I had to do an elimination diet. And I so very badly wanted like the microwave fix. Like, okay, I started my elimination diet, yesterday. I should be seeing results in his skin today. Like, no,
Yeah.
no, it's not going to work that way. It was so depressing to wait for weeks to see a change and knowing that I couldn't do anything to speed it up because he didn't have a steroid deficiency. Like there
Mhm.
was something that I needed to be changing. And that's the case with everybody's health.
Yeah, for sure.
Yeah,
And
but
that's
we
why I
want
like,
those overnight fixes.
right, we do. And that's why I offer the coaching with it, because you want somebody there to help keep you accountable, to listen to you during those frustrating times where you feel like things aren't working. And a term I frequently use with my clients is we're peeling back the layers of the onion. An onion has so many layers. We could peel back one layer and resolve some of the issues, but then we could completely uncover something else. So it's just, you have to remember that you didn't get in the health that you're in now overnight, and it's not going to reverse overnight either.
Right. Yes. So with all the testing, is there any common misconceptions that people have around testing?
I think that, people aren't used to the testing that I do. They're different. They look at things differently. They're more comprehensive. Um, there's pros and cons to every test. The body is constantly changing chemically. Blood work, you could get blood work done this morning and then this afternoon, and it will be totally different. So there's those aspects. And when I use this testing, I'm not a doctor. I don't diagnose. I'm not looking at these for a diagnosis. We're looking at them to see correlation with your symptoms, what stressors you have going on. And then we work with the body. So I think that's the biggest thing, is just, it's not to diagnose you. It's just to see where we need to support the body.
I love that viewpoint. We need that like shouted out loud and clear
Yeah.
because
Yeah.
people feel like they're going to see somebody, you, me, whoever, and we're going to give them a diagnosis. No, nope. I'm not a doctor. You're not a doctor. I'm not going to diagnose you, but that doesn't mean that we can't help you. We can
Right.
still help you. You don't need a diagnosis to make changes in your life.
For sure.
Yes.
Absolutely. Right.
So I have a question from our school community. It's Health with Hashimoto's on school, SKOOL.com. This person, it was Emily, she wrote, does anyone else have facial acne breakouts, eczema in ears, itchy scalp, sleeplessness, and slow healing skin scrapes? So in all of her complaints, there's a ton of skin stuff,
Mhm.
and your story started with skin. So can you tell my listener a little bit about thyroid and skin or what you would be looking at there?
Gosh, yeah. When I hear all those symptoms, right, because they are symptoms, I just think of the interconnectedness that we talked about a little bit earlier. You may have a thyroid issue, and yes, the thyroid can definitely impact your hair and your skin. But when you start talking about like eczema and itchiness, and I can't remember everything that you said, I start thinking gut. Do we possibly have some candida? Do we have any parasites? Do we have, um, too little gut bacteria, or do we have too much gut bacteria? Because everything in the body needs to be in a perfect balance, not too much, not too little. Um, so really, there's a lot of ways you could go with that. And that's why I do the testing, so that we're not guessing at what the issue is. We have concrete data.
Right.
So as far as the thyroid goes, there's a bidirectional axis between the gut and the thyroid. And, the thyroid can impact the gut, and then the gut can impact the thyroid. And we just have to figure out where those stressors lie so that we can decrease that inflammation, decrease that immune response, and, try to resolve some of those issues.
Yeah. Yeah. There's no quick fix.
No, there's not.
And everything is related to everything. When I started going back to school for holistic health, the professor would say that all the time. And I'm like, I don't want everything to be related to everything. I just want a quick answer.
I
Like,
know
give
it
me
would be so much
straightforward,
easier if it was just one thing, but it's
right?
usually not. And then, like I mentioned, hidden before in the metabolic chaos, those systems bounce off each other. So you just never know where the true root of the issue lies. But we don't necessarily have to know the root of the issue. If we see those stressors and we start removing those stressors and start balancing the body, eventually it will come back to homeostasis.
Yeah. Is there something that you see in a lot of your clients to say, like, you know, I've worked with 100 women and 99 of them needed to remove this particular thing as a stressor? Is there anything like that?
Yes, you might know what I'm going to say, but really, especially with Hashimoto's, the biggest trigger is going to be gluten, and the gluten impact on your gut. But there's also cross-reactive foods, and this is why food sensitivity testing can be important. Some people also react to the soy, the dairy, because they're inflammatory on the body. And if you already have autoimmune issues, you want to try to remove as many of those inflammatory foods as possible. So I would say gluten is the biggest one. And when my clients remove the gluten, and the ones that will do the gluten and the dairy, they see tremendous improvement in their skin.
Yeah. What are some tips to get started if you want to go gluten free? Because a lot of women, they're nervous, they're scared, like it's too high of a hurdle. What are your tips for going gluten free?
Well, I will say that I went gluten free when I was searching for my own answers, and I didn't know you should be gluten free 10 years ago. It wasn't a huge thing. Um, I think the biggest thing is to just do it, just to pick that one thing. If you just take gluten out, the most important thing is reading your labels because it's hidden everywhere in sauces, condiments, it's in makeup and skincare products, it's everywhere. So you have to be careful. Um, but you have the advantage if you start doing that now that I didn't have 10 years ago, is there's so many good substitutes. So it's really not as hard to do now as it was when I did it 10 years ago.
I totally agree.
Yeah.
There was not a lot of substitutes when I went gluten free either.
And it tasted like cardboard. Now
Oh
it
my
actually
goodness.
tastes like real food.
Yes. Yes. And a while back, I did an episode on hidden sources of gluten.
Mm.
And then, like, I don't know, a month or two later, somebody on Facebook is like, did you know that levothyroxine has gluten in it? I'm like, wait, what?
Yeah.
That wasn't part of
Corn.
my hidden one.
Mhm.
So I called my pharmacist and then I did an episode on that. And it's in some of the fillers and not
Mhm.
every brand. So the only way you know is by calling your pharmacist because it's not on the label. Like
Yeah.
when you get your medicine bottle,
Yeah.
I mean, you're right. It's so tricky. It's so hidden. And sometimes you have to go beyond reading the label and
Right.
actually call the pharmacy.
Right. I have a client who tested for corn sensitivity. So
Mm,
that's one of those cross reactives that the body can kind of view. Is called molecular mimicry. It views the structure similar to gluten, and then if you have autoimmune issues, it confuses those as, antibodies attacking, that kind of thing. But she realized that corn was in her, I think it was a T, is it cytomel maybe? Um,
okay.
I think there's corn in there, and it was one of the triggers for her. Just that little bit that she was getting in that um, was causing issues for her. So, yeah, you have to be very
Yeah.
careful.
So she's taking the medication to feel better, to replace
Mhm.
something that her body isn't doing. And then by doing the good thing, she's also causing the bad thing. I mean, you're right, it's peeling back the layers of the onion.
Um,
Yeah. So did she have to switch brands or what did she do?
She actually went a totally different route, but yeah,
Okay.
it was coming away from it.
Yep. So tricky. I'm so glad that, people have experts like you to
Mm.
help them peel back those layers and figure everything out.
There's
It,
just so much information out there you would never be able to. And I'm still learning of hidden things. It's just a never ending journey of learning.
yes. Yes, and conflicting
Hmm.
things. Like every time ask a question, especially with AI now,
Hmm.
you type in something into Google or your search engine of choice and it gives you the AI answer first. And sometimes it's completely wrong.
Yeah.
And, I'll ask it, what are your sources for that? And
Right.
like argue with the AI because sometimes it's wrong, but people are like, oh, the AI is probably compiling the top answers. So of course this is right. And it's not.
Yeah. And, I heard recently that another practitioner went and got incorrect information from AI because she knew this from her training. And she asked it where it got it. And it turned out to be, I guess, just searching like Facebook groups or like online groups. And so it
Oh
was just the
no.
chitter chatter between people. And so it recognized that as credible information when it was just people's opinions, So you really have to ask for, you know, reputable sources.
Oh my goodness. That's crazy.
Yeah, it's kind of
For
scary.
Yeah, it is. For a while, Google had like they weighted your expertise
Mm.
when they were doing their search engine stuff. And so maybe the AI forgot to do that. That's scary,
It's not as smart as it thinks it is.
right?
Yeah.
um, okay, so if somebody is just beginning to address their root causes, they're thinking about maybe working with you, doing all the testing, they schedule their appointment. What should they do first, either while they're waiting to work with you or, yeah, just first?
You can always start, and I do a free discovery call with people to learn about them, and then we individualize what testing and what protocols, because I said we are all bio individuals, so I don't cookie cutter my protocols or my process at all. Um, but when my clients get their labs, they do these labs at home, and then we're in that, 3 to 4 week waiting period. We work on the basics, Are you eliminating through your bowels? Are you sweating? Are you hydrating? So we work on drainage pathways, and then we work on starting to implement some of those dietary changes. Like, let's read your labels. Let's look at how much sugar you're eating. Are you eating enough fruits and vegetables? And we just start with the basics until we have more information. So, I like to use that time instead of waste it because we can get started with the simple things right away.
Absolutely. Yes. And the elimination, like just like be honest, how many times a day or a week or month should somebody be pooping?
So, I had someone tell me they were only pooping twice a week, and I was like, oh my gosh, all that stuff is stagnating in your gut. It's recirculating through your liver, it's adding to your toxic burden. So, I prefer at least one good bowel movement a day. If you're eating properly and you're hydrating, you should have that. If you're not, then there's obviously a deeper issue as to why you would be constipated. But we know constipation is a side effect of thyroid issues because it slows things down. So, we use some methods to help move that along and get things going.
Yes. Yes. Yeah. You don't want a septic tank
No.
inside or an outhouse inside your gut. Yes, I've taken care of a lot of people with that too. And I'm like, wait,
Yeah,
what? You
I
last
know.
pooped a week ago?
I know. Yeah.
Yes.
Well, and then
Yep.
you have people that deal with diarrhea constantly, and so
Yes.
they think they're constipated when they come down to one or two bowel movements a day, and it's like, no, that's normal,
Right.
So you have it on both sides of the spectrum.
Absolutely. You do. Everybody has stuff that they can work on. And I love that you make it simple and you're focusing on like those sustainable things,
Mhm.
working on lifestyle, working on diet, and really empowering your clients to know what they're doing and why they're doing it. I have heard that like as a subtext through everything you've said.
Yeah.
That is good. So if there is one thing you want somebody to take away from our conversation today, what would that be?
Gosh. I think the biggest thing I learned is to keep fighting for your health. There is an answer out there why you're experiencing what you're experiencing. You just have to dig deeper, find someone that you resonate with that can help you. Um, don't settle if it doesn't feel right.
Yes. Yes. So if somebody wants to connect with you, where is the best place for them to find you?
Yeah, I'm active on Instagram at Alissabeth Taylor Wellness. And then my website is elisabethtaylorwellness.com. And, I love talking to people, helping people. So I would love to connect.
Perfect. And I'll have those links down in the show notes. Thank you so much for joining the Health with Hashimoto's podcast today and for all of the wisdom and the guidance that you shared today. Thank you.
Thanks for having me.